Hello everyone, welcome to Clinical Knowledge and Medicine. So, today we will talk about rheumatoid arthritis. Now, this disorder is most commonly seen in females around 25 to 55 years of age group, and in this deformity, as you can see this figure, that there will be involvement of joints of wrist, hands and toes. So the definition of rheumatoid arthritis is it is a chronic inflammatory joint disease with a multi-system involvement. So if I need to show you the joints of hands, this is my finger. So this is distal interphalangeal joint, this is proximal interphalangeal joint, the middle one, and the last one is metacarpal phalangeal joint. So in the deformity, as you can see in swan neck, there will be involvement of PIP joint and DIP joint. So DIP joint is flexed and PIP joint is hyper extended. Next, there is Z-line deformity. In this also, there will be involvement of joint. And the last, third deformity is Botniot deformity, which is totally opposite of swan neck deformity. In this deformity, there will be hyper extension of DIP joint, whereas there will be flexion in PIP joint. So after seeing this deformity, let's talk about the clinical features one by one. So onset, which is insidious onset with fatigue, anorexia, weakness and vague musculoskeletal symptoms will be seen. Further articular manifestations, there will be symmetrical involvement of joints, which is characterized by pain, swelling, tenderness and painful limitation of movements. Then there will be general stiffness, but the morning stiffness will last more than 1 hour, and in this morning stiffness the patient cannot even hold his toothbrush nicely. And then clinical features of hand and wrist, as I told you earlier, there will be swan neck deformity, Botniot deformity, and in swan neck there is hyperextension of PIP and flexion of DIP. In this deformity, second deformity is totally opposite of swan neck deformity. Now foot and ankle, there will be broadening of forefoot due to metatarsophalangeal joints, hallux valgus, eversion of the hind foot. In hallux valgus, deformity is seen in the big toe at metatarsophalangeal joint. This is your big toe, and at the MTP joint there is deformity. Next, there will be flexion, contractures of elbow, wrist, knee, hips, shoulder. Joint involvement can occur, and there is also involvement of cervical spine which results into atlanto-subluxation with progressive spastic quadriparesis. So as you can see, there is yoga mentioned. So if a rheumatoid arthritis patient starts doing yoga, which is beneficial in this deformity, but if you particularly do headstand, so due to the trauma in cervical spine, there will be atlanto-axial subluxation, which can also lead to quadriparesis. So this patient is recommended not to do any headstand, which might give trauma to the cervical spine. Normal exercises are highly recommended in rheumatoid arthritis. So cricoretinoid joint involvement results in hoarseness of voice, pain and swelling behind the knee. After these clinical features, I would like to talk about the pathology of rheumatoid arthritis. But there is no definitive cause of this autosomal disorder, because there are many pathology behind this and not one specific reason or cause is present for this deformity. So in the pathology, you can see the diagram right here. One side there is healthy bone structure and cartilage present with normal blood flow, and there is no inflammation, while on the other hand you can see the structure and synovial membrane. There is bone erosion, cartilage erosion will be also seen, and there will be swelling in synovial membrane. So why this all takes place? Basically, the membrane, synovial membrane, is known as synovium, and due to the inflammation of synovium, there will be synovitis. The inflammation of synovium is known as synovitis, and as we all know, synovium is responsible for the production of synovial fluid, which helps in the lubrication. But now in rheumatoid arthritis, there is inflammation of this synovium, and which will cause pain and swelling around synovial membrane. Then there will also be bone erosion. So now further at the cellular level, the next diagram, if we broaden the picture inside the cellular level, you can see there is macrophage present inside, and this macrophage starts to form cytokines, which are interleukin 1, interleukin 6 and TNF alpha. Now these cytokines are responsible for inflammation of the synovial membrane, and furthermore these neutrophils production also leads inflammation. Now here you can see the T cell. T cells also produce cytokines TNF alpha, which will produce furthermore inflammation. So due to the release of these cytokines, the normal anatomy or physiology inside the synovial joints will be disrupted. Furthermore, after the inflammation and erosion, you might be wondering where these all cytokines or cells comes from. So basically, there is a pre-rheumatoid arthritis phase, and in this phase, due to the genetics role or smoking, these causes will lead to the production of autoantigens modification, which is modification of your own genes, antigens. So due to this modification, your own immune cells will be foreign to your body. Furthermore, due to this, there will be antigen presenting cell which will be activated, and this APC will further activate the T cell. Now, due to the activation of T cell, they will produce antibodies, and these antibodies will act against your own antigens. So, due to this, there will be production of cells, cytokines, and which I have already mentioned, interleukin 1, interleukin 6, TNF alpha, many more will be produced, which will lead to the inflammation and bone erosion, cartilage erosion.